Welcome to the Checkup. I'm Maya Goldman, Modern Healthcare's Rules and Regulations reporter. Medicare is one of the largest payers of healthcare in the United States, with about 64.5 million enrolled beneficiaries in 2022. Enrollment is expected to grow significantly in the coming years as the country's population ages. Over 1.4 million providers and more than 6,000 hospitals accept Medicare. The program sets coverage trends that private payers often follow. Today, we're joined by Dr. Meena Seshamani, the director of the Center for Medicare at the Federal Centers for Medicare and Medicaid Services, to talk about recent developments in the program and what could come in the near future. Meena, thanks so much for joining me.
It's great to be here with you today.
Meena, your office proposed essentially an overhaul of the Medicare Shared Savings Program, which is CMS's Permanent Accountable Care Organization program, back in July. What's behind those changes?
Well, again, thanks for having me here today and to be able to talk about this exciting work. As some of you may have seen, back in January, I published, along with our administrator, Chiquita Brooks-LaSure, and CMMI director, Liz Fowler, a vision for Medicare around several pillars, namely advancing health equity, expanding access to coverage and care, driving innovation for high quality whole person care, and promoting good stewardship of the program with affordability and sustainability for future generations. And the Medicare Shared Savings Program and our value-based care programs overall are really a key way to drive those pillars, where the Medicare Shared Savings Program is able to encourage more coordinated care for people with Medicare, bringing in health-related social needs issues, encouraging a more team-based approach to care, and being able to reward providers who are providing high-quality care and spending the Medicare dollar in the most effective way to drive better outcomes. And with that high-level strategic vision in mind, we have proposed several changes to the Medicare Shared Savings Program, as you mentioned, Maya. So first, piggybacking off of a successful model that was tested in CMMI, we're proposing to create these advanced incentive payments, where particularly in rural and underserved areas where you have small providers, being able to give resources upfront, money upfront, for providers to invest in the infrastructure that they need to provide this improved care. And so being able to provide this money, which could also be used for health-related social needs, which is a very important aspect of this more holistic approach to care, so that more providers can participate in these models, and particularly in rural and underserved areas. There are also provisions specifically around health equity, like a health equity adjustment to be able to reward excellent care that's provided for underserved populations. And work around the benchmark, changes to the benchmark that we're proposing, again, with an eye towards how can we recruit more providers to engage in these models, and how do we make it so that people stay in these models. And all of this work is towards that goal of being able to grow participation in the Medicare Shared Savings Program so that we can meet our goal of 100% of traditional Medicare beneficiaries in one of these accountable care relationships by 2030.
Yeah, so that leads really well into my next question, which was, if these proposals are finalized, what will success look like? What's a marker of success in this MSSP overhaul?
Absolutely, that is a great question. And at a very high level, we want to drive better care, to have improved outcomes and healthier populations with smarter spending, and leveraging the chassis of the Medicare Shared Savings Program is a key way to do that. And the changes that you're seeing being proposed in the Medicare Shared Savings Program are really aimed towards that end. We want to be able to grow participation in these models. We want to have a defined and deliberate focus on equity in these models so that you can really get at the myriad of issues that go into someone's health and the disparities that have existed in our society around health and healthcare. and being able to align our programs across Medicare. As a provider who was until recently leading a lot of these care transformation efforts, I know how important it is that we're all rowing in the same direction and engaging in a thoughtful way together to be able to make improvements. And so the example in the Medicare Shared Savings Program proposed rule of taking a test that worked in CMMI and being able to scale in the full Medicare program is just one example of where we also seek to align our programs more with each other so that everybody who's involved in caring for people are able to row in the same direction to really drive change on the ground.
Yeah, and the incentive payment that physicians can receive for participating in advanced alternative payment models will disappear after this year unless Congress acts to extend that. And I know that that is out of your hands whether that happens or not. But if that's not extended, how will that expiration affect your programs in your work?
Well, through what we're proposing in this rule, we are absolutely looking for ways to continue to encourage providers to be in these models so that more people with Medicare can benefit from these holistic models. So being able to give these incentive payments up front to support investments in infrastructure, which I have heard as I've gone around the country meeting with accountable care organization in rural New Mexico, for example, or an accountable care organization in New York that cares for an intellectually and developmentally disabled population. This really rang through as an area for improvement, and so we are proposing it. Thinking about the benchmarking and where there are opportunities to make adjustments there, again, so that you can encourage more participation in these models because we have seen that they work. We recently published for 2021 that the Medicare Shared Savings Program for the 5th year in a row is saving money for the Medicare program, $1.6 billion, and delivering higher quality than people not in these kinds of models. And so really being able in all avenues to be able to encourage that direction and that movement.
Mm-hmm. Yeah, another program that's been top of mind for lots of modern healthcare readers lately is Medicare Advantage, which also falls under your purview. And I know CMS recently accepted comments on a request for information about the program. Why did you decide to release the RFI, and how will your office approach sifting through all those comments? I know there were a lot of them, and deciding what to incorporate.
And the fact that there are a lot of comments is a very good thing. One of our strategic, so I mentioned our strategic pillars around equity, around high quality whole person care, around affordability and sustainability. None of that will be possible without strong partnership across the entire ecosystem that cares for people in this system. And that is why we are doing the RFI. Again, I know coming from my background where I was involved in care at the last mile, including patients at my bedside, including being on the leadership role in a health system, how important it is that we hear from all perspectives, everybody involved in the Medicare Advantage program, we talked about our value-based care programs, because that's the only way that you can really drive thoughtful and meaningful change. And so being able to do this request for information that is organized according to these strategic pillars, because Medicare Advantage is a very important part of the Medicare program. And we want to make sure that we continue to improve it so that it drives on these strategic pillars of equity, of access, of innovation, of stewardship. And so we are very heartened by all of the interest that we have gotten, all the comments we've gotten from people with Medicare to entrepreneurs and innovators, to plans, to providers. There are so many people who are involved in the Medicare Advantage program, and that's a key piece to how we're going to be able to move forward together and continue to improve Medicare overall.
Yeah, and how will you look through those comments and decide, what might be added to the program and what might not?
Yeah, I mean, we will be reading through the comments. Also, I think by doing this RFI, it demonstrates again that we're an open door. We want to hear from people. We want people to engage with us and come speak with us about what are the things that they see as the top priorities of how we can make sure that Medicare Advantage continues to drive the strategic pillars of the Medicare program.
Yeah. And Medicare Advantage is expected to enroll more than half of all beneficiaries, I think, as soon as next year. So, what does your office need to do to adapt to this shift?
I think that what we are doing is exactly what we need to do, in that Medicare Advantage is a key part of the Medicare program. So you have parts A and B in our traditional Medicare. We talked a little bit about the value-based care models, that we are doing there as well. Then you have Part C, Medicare Advantage. You have Part D for prescription drugs, and then you have supplemental insurance such as Medigap. All of those pieces together create the Medicare program. And it is so key that through our policymaking, through our operations, we are driving all of those towards those strategic pillars that I mentioned, and doing so in partnership with everybody that is involved in making care happen for people who rely on our program.
Mm-hmm. Yeah. And interestingly, reports have raised some concerns about prior authorization within the Medicare Advantage program, and some other elements that maybe need some details ironed out. So, is there anything on the horizon to help tackle prior authorization specifically, and other potential issues within the Medicare Advantage program?
Prior authorization is one of many areas that we asked about in our request for information, where we're interested in seeing where things are working, and where things are working that we want to make sure continue to work, where we can continue to innovate, continue to scale, and where there may be improvements. And so that goes for prior authorization as it does with innovations around health related social needs, et cetera. That is in part why we put out that request for information, because we want to be able to get ideas, gain those perspectives and experiences from the tremendously diverse ecosystem that's caring for people, so that we can together see where there are opportunities for improvement collectively.
Mm-hmm. I know our readers will be watching out for all that happens in that space. Switching gears a little bit, Medicare will begin negotiating prices for certain covered drugs in 2026 after Congress passed the Inflation Reduction Act earlier this summer. What's your plan for implementing that act, and what do providers and insurers need to know about that?
Yes, so we have hit the ground running on implementation. And one theme that we've been talking about, Maya, that I'd like to pick up on here again is the importance of collaboration and engagement with everybody involved in this. Again, as a physician, I cared for patients who had difficulty affording some of their prescription drugs. In fact, one woman who was on Medicare, we were on our smartphones on the GoodRx app trying to find an antibiotic that she could afford. And there are several things in this law, like $35 per prescription per month cap on insulin copays, like recommended vaccines at zero out-of-pocket cost for people with Medicare, limiting the overall out-of-pocket cost for people for drugs to $2,000 a month. There are some really good provisions that can bring real cost savings to people with Medicare, and we want to be able to work on those collaboratively. And similarly with the drug negotiation, being able to engage with the whole ecosystem that cares for people with Medicare, so that we can implement these provisions in the most thoughtful and impactful way possible. And if I can make one more point, and again, this is coming from, someone who has been at the bedside with patients, I think for all of you who are caring for people on the ground, who are engaged as plans with your enrollees, as providers with your patients, people will ask, what does this mean for us? What's in this law? And all of you play a very important role, not only in collaborating and engaging with us as we implement, but then also helping to explain it to people who can benefit, so that they can make the most of it. And so, on cms.gov, we'll have a fact sheet that you can reference. We definitely plan on doing outreach also with all of you, so that you are able, in partnership with us, to be able to engage in the full ecosystem that's involved in caring for people with Medicare and directly with people who have Medicare so that they can understand the changes that are happening.
Yeah, and I know we're almost at the end of our time, but one last question for you here that I know is important to you. Improving health equity is a major goal for CMS right now. So what do you mean when you talk about health equity, and what can our audience of providers and insurers and healthcare executives do to help you accomplish that goal?
That's a great question, because I do think so many times I said, let's take a step back and what do we mean when we say health equity, right? So when we talk about health equity, we mean everyone having a fair and just opportunity to attain their optimal health, regardless of their race, ethnicity, geography, language, socioeconomic status, gender identity, sexual orientation, the myriad of factors that go into being able to access healthcare and the myriad of factors that impact someone's health. And that really is central to everything that we do in our program. So for our day-to-day operations, making sure that care is navigable, that people can understand what their options are, that they can access what they need. So having multi-language inserts and required free translation services for language access, for example. To how do we have more specific policies that really target advancing equity and reducing disparities? Like the example I gave, we talked about with the Medicare Shared Savings Program around proposing a health equity adjustment that will reward care for excellent care in underserved populations. Or our graduate medical education, we're rolling out 200 slots a year for the next 5 years, targeting, prioritizing rural and underserved areas. So you can build the capacity of the healthcare system to address disparities, because where people train, they learn the needs of those communities and they're more likely to stay in practice. So really thinking about equity across all of our programs, embedded in every single policy and every single operation that we do. And to your point, how can others help? It's also, how can we help you, right? This is a partnership for all of us together, from the manufacturers to the providers, to the payers, to the patient groups, the community-based organizations, the employers and the unions. The list goes on of everybody who's involved in healthcare in our country, and everybody who's involved in making sure that, you know, people in this country stay healthy. And so I really see it as a partnership where together we can advance health equity along these lines.
Well, thank you so much for joining us, Meena. Meena Seshamani is the director of the Center for Medicare under the Biden administration, and we hope to talk more with you soon.
Great being here with you, and look forward to it.
Thank you. And I'm Maya Goldman. Thank you for listening to The Checkup.